Corticosteroids, potent anti-inflammatory and immunosuppressive agents. Corticosteroids are powerful medications that act as potent anti-inflammatory and immunosuppressive agents, mimicking the effects of cortisol, a hormone naturally produced by our adrenal glands. These synthetic hormones effectively reduce inflammation by inhibiting multiple inflammatory pathways in the body. They are crucial for treating acute inflammatory flares and managing chronic autoimmune conditions. Normally, our adrenal glands, two small glands located on top of the kidneys, produce cortisol. Corticosteroids are a synthetic version of these hormones, designed to reduce inflammation and suppress the immune system. Common uses and indications: corticosteroids are widely prescribed across various medical fields for a range of conditions. Here are some common indications. Allergy and pulmonology, used for conditions like asthma or chronic obstructive pulmonary disease. COPD, exacerbations, anaphylaxis, urticaria and angioedema, rhinitis, pneumonitis, sarcoidosis, and interstitial lung disease. Dermatology, effective in treating contact dermatitis and pemphigus vulgaris. Endocrinology, essential for managing adrenal insufficiency and congenital adrenal hyperplasia. Gastroenterology, prescribed for inflammatory bowel disease and autoimmune hepatitis. Hematology, used in cases of hemolytic anemia, leukemia, lymphoma, and idiopathic thrombocytopenic purpura. Rheumatology, crucial for conditions such as rheumatoid arthritis, systemic lupus erythematosus, polymyositis, dermatomyositis, and polymyalgia rheumatica. Ophthalmology, applied in treating uveitis and keratoconjunctivitis. Other, play a vital role in organ transplantation, promoting antenatal lung maturation, nephrotic syndrome, cerebral edema, and managing multiple sclerosis. Types of systemic, oral corticosteroids. These forms of corticosteroids reduce inflammation and are used to treat autoimmune, allergic, and various inflammatory conditions. Some common examples include prednisolone, marketed as Oripred, Prelone, and Pediapred. Dexamethasone, known by the brand name Decadron. Methylprednisolone, often found in Medrol dose pack. Betamethasone, marketed as Celestone. Hydrocortisone, available as Cortef, Cortade, and in intravenous form as Solocortef. Prednisone, sold under the names Deltasone and Reyes. Important considerations and side effects. While highly effective, corticosteroids do come with potential side effects, especially with long-term use. These can include hyperglycemia, high blood sugar, osteoporosis, weakening of bones, increased risk of infection, and weight gain. Auxiliary labels and usage. Patients are typically advised to take corticosteroids with food to minimize stomach upset. It's crucial not to stop corticosteroids abruptly, as this can lead to serious withdrawal symptoms. A gradual tapering off the medication is often required. They are sometimes dispensed in dose packs like the Medrol dose pack, designed for short-term specific treatment bursts. Inhaled and nasal corticosteroids, targeted relief for asthma and allergies. When it comes to managing conditions like asthma and seasonal allergies, inhaled and nasal corticosteroids are often a frontline defense. Unlike their systemic counterparts, which affect the entire body, these corticosteroids are designed to deliver a potent anti-inflammatory action directly to the affected airways or nasal passages, minimizing systemic side effects. How they work locally. These medications work by reducing inflammation in the lining of the airways, for asthma, or the nasal passages, for allergies. By calming this inflammation, they help to prevent symptoms like wheezing, shortness of breath, nasal congestion, sneezing, and runny nose. They are not typically fast-acting rescue medications, but rather preventative treatments that build up effectiveness over time with regular use. Key benefits. Targeted action. Delivers the medication directly where it's needed, reducing the risk of widespread side effects. Effective prevention. Helps to prevent asthma attacks and severe allergic reactions by controlling underlying inflammation. Improved quality of life. Regular use can significantly reduce chronic symptoms, allowing for better breathing and reduced discomfort. Common examples of inhaled nasal corticosteroids. Here are some widely prescribed inhaled and nasal corticosteroids. Mometasone, available as an inhaled corticosteroid under brand names like Asthmanex for asthma, and as a nasal spray like Nasonex for allergic rhinitis. A topical form, Elocun, is also available for skin conditions. Fluticasone, known for its effectiveness in both inhaled and nasal forms. Flonase is a popular nasal spray for allergies, while Flovent is an inhaled version used to manage asthma. Budesonide, often recognized by its brand name Pulmicort, this inhaled corticosteroid is commonly used for asthma management. Beclomethasone, marketed as Kvar, this is another inhaled corticosteroid primarily used for asthma. Regular and consistent use of these medications, as prescribed by a healthcare professional, is key to achieving optimal control over asthma and allergy symptoms. They are a cornerstone of long-term management, helping millions breathe easier and live more comfortably.